So what is the world's most powerful weight loss device? Is it a treadmill? Is it an elliptical machine? Is it a scalpel to do lap band or gastric bypass surgery? No, it's one of these devices. This is a Dario device. This is a Precision Extra. This is a One Touch Ultra. They're glucose meters. Yes, that's the most powerful weight loss device you can get, if used properly. Sadly, if you go to your primary care doctor or other doctors, they'll tell you that's not how you use a glucose meter. They'll say something like, well, if you're going to check a blood glucose, first of all, you should be diabetic. But if you're not, you're still going to check a blood sugar prior to a meal and then 2 hours later to see whether blood sugar comes back down to baseline, because if it doesn't, you may need to adjust or introduce insulin or other diabetes drugs. In other words, my colleagues, my mainstream colleagues, use these devices, these glucose meters, as nothing more than as a tool to monitor blood sugar excursions or variation after a meal for diabetes control. That's not what I'm talking about. I'm talking about trying to see where you start, the baseline prior to a meal, and then seeing where the peak blood sugar occurs. Now, when I eat a meal, depending on its composition, how much protein, fat, carbohydrates, how much liquid, the pH, how much fiber, etc., other factors, that will determine how soon after I start eating the peak blood sugar will occur. But it typically occurs 30 to 60 minutes after the start of the meal. So you can approximate that by getting a blood sugar around 30 to 60 minutes after the start of a meal. Now, if you want to be absolutely precise, you could do blood finger sticks every 15 minutes and see where the peak actually falls, and it may be at 45 minutes, maybe just a little after 60 minutes, but 30 to 60 minutes you'll find will give you a pretty good approximation of the peak. And here's the magic. You want to follow what I call it my wheat belly or undoctored no change rule. What you're looking for is the start of the blood sugar, and that 30 to 60 minute later blood sugar should be no higher. So let's say you start at 90 before your meal and your blood sugar is 97. That's no change. You have to accept that all these devices are accurate, plus or minus about 15 milligrams. So 90 to about 105 is really no different. That's the inaccuracy built into these devices. They're getting better, but they still have about a 15 milligram per deciliter inaccuracy built in. So if you went from 90 to 97, 98, that's no change. That's what you want. What if you went from 90 to 148? That's too much change. Look back at the meal you had, identify the food, it will be a carbohydrate. Next time, cut back on portion size dramatically or eliminate that food. Replace it with something that doesn't raise your blood sugar. What if you went from, let's say, 90 to 180, as is typical, by the way, after a bowl of oatmeal? You know that stuff? Full of fiber and heart healthy? No, it sends your blood sugar sky high. So you know that oatmeal is a very bad choice for you. Likewise, if you start at a high level, let's say you do have prediabetes already or type 2 diabetes and your starting blood sugar is 115, same rule applies. If you start 115 prior to a meal and then 30 to 60 minutes after the start of the meal, you're at 157, there's something wrong, right? Look back at that meal, identify the food that raised your blood sugar, it'll be a carbohydrate, cut it out or at least cut back on portion size. The more you do this, you'll find that not only do the 30 to 60 minute values drop, but the fasting level drops also if it's above 90. We want to be between 70 and 90 is a perfect level. So if you start at 110, which is in the many pre-diabetics have that kind of value, and you keep it to 110 give or take, right, at that 30 to 60 minute mark, you'll see that 110 fasting level begin to drop over time. Do this. Adhere to the no change rule, and you'll start to see the pounds dropping off faster and faster. And the reason for that is you're reversing insulin resistance, those high blood sugars that you used to have 30 to 60 minutes after consuming some food. That generates high blood glucose, which provokes high blood insulin. And recall that high blood insulin is the factor that causes weight gain and blocks fat mobilization. Now, if you want to go even faster, just doing that, by the way, is enormously effective for weight loss. It's also, by the way, enormously effective for reversing and even getting rid of type 2 diabetes. But you got to be careful. If you're on insulin or oral diabetes drugs or injectable drugs, oral diabetes drugs such as glimepiride, glyburide, and glipizide are especially dangerous because one of the things you don't want is low blood sugars. This approach is so effective, you're going to start to see a rapid drop in blood sugars if you remain on those medications. So ideally you find a doctor who's smart about making diabetics non-diabetic, but good luck. There's very few of them. So just be aware that you want to be very, very careful and will have to turn back doses or even stop some of these drugs if you're going to do this, because you do not want any hypoglycemia. You do not. Hyperglycemia is a chronic danger to you, high blood sugars. Hypoglycemia, low blood sugars, are an acute threat to you, right? You could pass out and be in a coma at a blood sugar of 40 or 50. You don't want that. Bottom line, these devices, my favorite, by the way, is the Dario device, just because it's kind of cool. It talks to your smartphone very nicely, automatically. It's very easy to use. And everything you need is right in this little container. The little finger stick devices, the test strips, everything, all in this one little kit. But there's many others too. Your doctor will even give them to you. He'll often just give them away. Or you can buy them at Walgreens, Walmart for about $20. They're very inexpensive. And they're a bargain because they're so darn effective at losing weight. But if you want to go even faster, so what you're achieving by following this no change rule in blood sugars is you're reversing insulin resistance. Well, you can even go faster in reversing insulin resistance that causes weight gain by taking the nutrients absent from your life because you live a modern lifestyle, like vitamin D, because you wear clothes, you probably work indoors, right? And you may be aging beyond age 40, so you lack vitamin D. Replace vitamin D. Magnesium, because we drink filtered water. Whether the city filters it or you filter, we have to filter our water, lacking magnesium. Iodine. About 20 to 30% of modern people are lacking iodine, so we all supplement iodine, and that improves thyroid performance in a lot of people. And we cultivate bowel flora and take omega-3 fatty acids. Those are all the basic components, by the way, of my Wheat Belly and Undoctored program. So if you want to go even faster, the no change rule using glucose meters is really a very powerful device, very powerful strategy. You can go even faster and attain even higher levels of health by adding those other components. Those are all detailed in my programs. If you want the latest edition of how we do this all in one resource, I just released a new book. It's the Wheat Belly Revised and Expanded Edition, available in all bookstores, including Amazon. And it's collected all the strategies in one place, including an update on all the information, new recipes, new success stories. So I invite you to take a look there if you want to get started on this program.